Welcome to Time for Health. I'm your host, Rachel Fall, and I'm very glad you're here. As always, we bring a topic to you. We have some experts in the field to talk about that topic, but I always give the disclaimer, don't use this as medical advice necessarily for yourself, or if you pass it on to somebody else, always talk to your healthcare provider before you make any decisions to do something or not do something. So today, I'm very excited to have Brianna Missler and Ashton Spear with us. Thank you for being here. I know you're so excited to be here. You are a speech therapist, and one of the many things that you do, we'll kind of talk about it, but this is particularly about Parkinson's and a new-ish therapy that you guys are trained and certified in to help people who have Parkinson's disease. So before we get to all that, tell me a little bit about yourselves, like what kind of a training speech therapy has and all that kind of stuff. Whoever wants to go first.
I'll go first. So I am currently a clinical fellow in speech therapy, which basically means that this is my first year out in the real world working a job. I graduated from Baldwin Wallace back in May 2018, and before that I went to Bowling Green State University. Go Falcons! But it's actually very hard to become a speech language pathologist. You have to go through undergrad school, which is usually 4 years, and then you have to compete like crazy to get into grad school, which is about 2 years. But it is possible.
Okay, good deal.
Yes.
Yeah.
You're training similar, or?
Yeah. I went to the University of Toledo, so go Rockets. I graduated in 2013 with my bachelor's degree, and then 2015 with my master's. And we're both employed with Nome's Advanced Health.
Sure.
A lot of people think that we're employed through Magruder, but we're actually not. We're contracted. I've been there at Magruder since June 1st, 2015, and have really been enjoying it.
Good. So it's a master's degree. Okay, has it always been to be a speech language pathologist?
Well, not always.
Not always.
Not
Okay,
always.
I thought.
But I'd say
A lot of therapies are kind of transitioning that way. It has to be masters, and then some have to be PhDs, and all that kind of stuff.
Yeah, it doesn't matter where you're working. It could be a nursing home, a school, hospital, ear, nose, and throat office. You have to have your master's to practice.
Okay. That was going to be one of my other questions is, I mean, I know you work in a hospital, but what are some of the other things a person can do who's a speech language pathologist?
Well, you could work in home health, which is what I do. I travel around from Fremont to Wakeman to Greenwich, and I go in people's homes and provide therapy there. Like Brianna said, you could also go in the schools, you could go in the nursing homes. You could actually own your own private practice if you have enough experience. You can build up a clientele, do it that way. There's plenty of things you can do.
And you work with all ages, correct? I know you work with kids, you work with seniors, and everybody in between.
Right.
Oh, yeah.
Okay.
Yeah.
What are some of the things you do with kids?
So I love working with kids. So a lot of what kids need help with are like speech sounds. So some of them can't say their R's very well or their THs. Sometimes it's language, so they might say, he is wearing green, when you're obviously a girl. So sometimes they mix those up. But for kids, it's fun because you can make therapy fun. Everything has to be a game.
Right.
And so, if you're that type of person with that personality, you can make everything a game. Scavenger hunt, everything like that. And so I do work more with adults now, but in grad school I worked a lot with the younger kiddos. And then we can also treat infants too. Like right out of the womb, we can treat them if they have problems with swallowing, formula or milk, anything like that. And then Brianna kind of has more of the other side of it, the adults. So I'll let her kind of talk about that.
Yeah. I see more of the adults, a lot of strokes, trouble getting their words out, understanding, reading, writing, spelling, those types of things. We also work with people that stutter, adults that stutter, memory problems, Alzheimer's and dementia. We can't cure it, but we can definitely give them compensatory strategies to try to help them with that. Traumatic brain injuries, if you've been in a car accident or a motorcycle accident, we can help with that.
Okay.
So we do a lot.
All kinds of things I didn't realize you guys did. Very cool.
Yeah. Thank you.
One of the things you do is this therapy for Parkinson's. But first, I have about this much knowledge of Parkinson's. So tell me a little, what is Parkinson's?
Well, Parkinson's is a disease of the central nervous system,
Okay.
and it affects your movement.
Okay.
Okay, so you get nerve cell damage in the brain, and it causes a decrease in your dopamine levels, and it causes symptoms of Parkinson's disease.
Okay.
And there's about 1 million people in the United States that actually have Parkinson's disease, and there's 4 to 6 million people worldwide that has Parkinson's.
Okay.
Yep.
a lot
And
more than I
that
thought.
prevalence is expected to double by 2040.
Okay.
Yes.
I think baby boomers are so just, and it impacts seniors,
Yeah.
adults,
Yeah,
seniors
yeah,
mostly?
you know, over the age of 40.
Okay.
Yeah.
Okay.
Yeah,
All right.
because the Parkinson's is a progressive disease, so it's only going to get worse. There are, medical treatments that can slow that progression, but no matter what you do, it's going to keep getting worse. And so, like with this treatment, it's made to kind of not stop the progression, but slow it down.
Slow down the
Yeah.
progression. Okay. So one of the things I know, shuffling gait and that, do you know what some of the symptoms are, or what some of the signs are besides shuffling gait? See, I told you, I know, that's about all I know.
That's okay. Yeah. So like you said, the shuffling gait, a really soft voice. They'll speak kind of in a whisper.
Oh.
Like you can't really understand what they're saying. And sometimes they don't even realize they're talking
They're
that
doing it.
softly. They say, well, you just have trouble hearing. And, it's like, no, sometimes, if they can't,
Okay.
if they're not understood over the phone or in a group conversation like this, or if there's background noise at a restaurant, they
hard
can't
to
be
hear.
heard over
Okay.
there. Yeah.
And so it's a nervous, so it's kind of obviously out of their control. It's not that
Yes.
they're purposely doing it. It's
Right, yeah.
the nerves working inside aren't firing
Yeah.
right or
Yeah,
whatever.
Yeah.
It's
And they
the-
feel like they're shouting.
Yes.
To them,
That's-
yeah,
yeah.
they feel like they're shouting, and they just don't understand. Like they'll say, "There's something wrong with your hearing," but there really isn't.
Yeah.
So.
Okay. All right.
Yeah.
So if somebody is diagnosed with Parkinson's, do they need a referral from a physician to see a speech language pathologist to do some therapies?
Basically, yes.
Okay.
What we call it is an order.
Okay.
They just call their doctor or visit their doctor and say, hey, I think I want some speech therapy. And they say, okay, and write an order for it and
Okay.
send it to Magruder or, wherever.
Yeah, sure, absolutely. So talk a little bit about some of the therapy. I think it's called Big and Loud. That's what I've heard it called, so that's what I'm going to refer to it as. So talk a little bit about it. I said it's new, but I don't actually know how new it is.
Sure, yeah. So LSVT Loud has been in existence for 25 years.
Not new.
Not new.
Kind of new.
Yeah,
in the
somewhat.
world of-
Yeah.
Okay.
And it was named after Mrs. Lee Silverman, and it was developed by Dr. Ramig 25 years ago. There's also LSVT Big, and that's like the physical portion.
Okay.
And that was developed from the LSVT Loud. So that's been in existence for 20 years.
Okay.
Yeah.
So is it after her? What's her name?
Yeah,
LS?
Lee Silverman, voice treatment. Yes.
I wondered what that.
Yeah.
See, I know. now.
Yeah,
Okay.
yeah.
Okay, so
yeah.
it's been around for 20, 25 years.
Yeah.
And there's two parts to it.
Right, yeah, yeah. And we were trained online. We took an online course in that. It's through Scottsdale, Arizona.
Okay.
That's where the headquarters
You didn't
are.
get to go to Arizona for that?
Unfortunately not.
I'd
Yeah.
like to try.
Yeah.
It is
yeah.
convenient online.
Yeah,
You
oh,
can
sure.
do it whenever you need
Right.
to. I took the training, I think, over the summertime, kind of right after I got hired, and I spent at least 10 hours doing all of it. But it's very intensive, very
Okay.
rigorous. They have you do kind of mini tests throughout the whole thing, and then one final exam, they call it, at
Okay.
the end, and you have to get a certain score to pass.
Gotcha.
So even if you just go through the PowerPoints and click, 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 and don't actually read them, you will fail and you won't get your
won't get-
certification.
Gotcha.
Yeah, so they
Okay.
make it in a way where you have to read and have to take in the education
Gotcha.
to do it. Yeah.
Yeah, yeah. There were 34 modules
Okay.
in this this session that really did a good job of showing like samples, video samples
Okay, I
of
was
what
gonna
the
say,
treatment looks like, and it was very helpful.
Okay,
Yeah.
so online, and then do you have to do it in person with somebody? Is that part of the training, or you do that after once you get certified?
It's after, once
Okay.
we're certified. Yeah,
Okay.
you have to have that certificate.
Before
yeah.
you can do it.
Yeah.
Okay. So can somebody do big and not loud, or loud and not big?
Yes.
Yes.
Okay.
Yes, because the LSVT big is done by an occupational therapist. We don't
Okay.
do that one.
Okay.
We just do the loud because that's with the voice.
The voice. Okay.
But yeah, if someone comes in and they just have the shuffled gait and they need help with their movements, they just see occupational therapy for
Okay.
that. But if they have a soft voice and their movements are okay, then they just see us. Yes.
Okay. I know you're not, to do the big part or whatever, but can you talk a little bit about what that involves? Like, are there 8 sessions with an occupational therapist, or is it widely varied in how it's handled?
I think there's 16 sessions,
Okay.
a total, 1 evaluation and then 16 treatment sessions. They look at posture, balance, getting up out of a chair, walking, even on uneven surfaces. Yeah, they'll take them outside and have them walk in the grass.
Okay.
So yeah, there's a lot of really neat things. They even work on writing because sometimes people's writing gets very small with Parkinson's, and so they work on those big movements.
Wow, there's all kinds of things I didn't realize. So
Yeah.
they work on that part of it.
Yeah.
Okay. So talk a little bit about just how maybe about the evaluation for the loud part.
Sure. Yeah.
So, so for the evaluation part, they come in, and then what's great about LSVT Loud in the training is they give you a whole book and a whole bunch of online worksheets that you can print out that give you step by step how to do the testing, what to do, what to ask. They give us a whole packet for interview questions. So we go through, we ask about medications they've taken, when they started noticing these symptoms. Like if they just have the soft voice, kind of, how does that affect you? Are you able to talk on the phone okay, order at a restaurant?
Okay.
Just kind of get their whole picture of how it affects them in this interview session. And then after that, we have them do kind of what we would have them do in treatment. We would have them hold out an ah for as long as they can and kind of see how loud they are.
Okay.
And we also have instruments to help us do this. So we have this instrument where we just have it kind of right by their mouth, and it measures how loud they are per decibels. So that kind of tells us, okay, they're within the average loudness for their age, because someone who's 20 going ah compared to someone who's 70 is different naturally.
Vocal cords just change like
Right.
everything else
Yeah.
does.
They do.
Exactly.
Okay.
So we have to use instrumentation to really have an accurate reading, to kind of know what we're doing with that.
So very thorough intake,
Yeah.
how it impacts
Oh,
their
yeah.
life and
Right.
measurements and all that kind of stuff.
It takes about an hour.
Okay.
The
Yeah.
whole
The first part.
evaluation.
Okay.
Yeah.
All right.
Yeah.
We are going to take a quick break, and we will be right back to talk more about big and loud. And we're back. We're talking about LSVT, which I now know what that stands for. Big and loud, which is a therapy for Parkinson's disease, mostly the loud part. We talked a little bit about the big part, how a person sees an occupational therapist. So one of the things that you talked about in the very beginning, when somebody gets a referral or whatever, is you do an assessment, because I would imagine that Parkinson's may look different from person to person. Or somebody might, maybe have the quiet voice, but maybe it doesn't impact their quality of life quite like it impacts maybe another person. So you do the whole assessment, the measurements, and all that kind of stuff ahead of time. How many sessions, or what does it look like, the rest of the therapy?
Sure. There's 16 total sessions. It's 4 days a week, consecutive days out of the week. So it's either Monday through Thursday or Tuesday through Friday.
Okay.
Yeah, for 4 weeks. It's a very intensive treatment.
So the consecutive, I'm assuming that's because evidence has shown that doing it consecutively
Right.
is sort of where the magic is. so to
Right.
speak.
Exactly.
Yes.
Okay, cool.
Yeah, yeah.
And each of those sessions is 1 hour.
Okay.
Yes.
So it's
It's very intense.
It's intensive.
intense. Okay.
Yes, it is.
Okay.
And that's
Yeah.
because they have done so much research at LSVT, because it's been shown that intensive short treatment, because this basically is 1 month for 16 sessions
Right.
for 4 weeks. that being intensive like that is much more beneficial than having it, say, over a span of 3 months.
Little bits
Right.
spread
Yes.
out. Okay. Okay.
Yeah.
So 4 sessions a week for an hour. Okay. Sorry. Continue.
Yeah. So a typical treatment session would look like having them hold out the vowel ah for as long as they can and as loud as they can. We do that 15 total times.
Okay.
And we're constantly coaching the patient to try to get them louder and hold it out longer. And then after that, we ask them to glide up to their highest note with the vowel ah. We do that 15 times.
sing?
Yeah.
Yes, basically.
Okay.
Yeah. And then we ask them to glide down to their lowest note that they can attain. And we do that 15 times. So the goal is to try to work on their breathing, because sometimes that can be affected too, and on their loudness. And of course, all throughout therapy, we're asking them like off the cuff questions, because they tend to be loud in those structured tasks. But once we start asking them, well, how's your voice feeling? Then their voice drops off.
Okay.
Yeah. So we're trying to get that carryover for them to maintain their loudness. And then we have them come up with 10 functional phrases. So these are phrases that they say on a daily basis. Things like, where are my glasses? What's for dinner? Where are my shoes? Those types of things.
Where are my car keys?
Yeah, exactly. yeah,
That's
yeah.
mine.
So, and so we have them say those 10 phrases a total of 5 times. And we're constantly coaching them through that, trying them to get them louder. Then we do a hierarchical task where week 1 we start with single words and phrases, and then week 2 is more like sentences, then week 3 is paragraph, and then week 4 is conversation.
Okay.
So the idea is to slowly get them up to conversational level with being loud. And the sessions are very interesting for the patients, because we ask them to bring in therapy material or material that they enjoy, that interests them.
Okay.
And it makes them want to be motivated.
Right.
You know.
They're
so.
not just reading out of a dictionary or
Right,
something like
yeah,
that.
or just
Yes.
random sentences or
Okay.
things. So yeah, it makes it fun. Yeah.
So you build on, you kind of start small and work with that consistency with just the sound and then the word and then the sentence and that kind of stuff for 4 weeks.
Yeah.
Do people, like, do you follow up with people afterwards to kind of make sure they're kind of still carrying through with the things that they've learned, or?
Yeah, every so often.
Okay.
Yeah. And the other big part of this is we give them homework. So they get a binder, and it has the different exercises that we do. And of course, they're not going to be doing 15 repetitions.
Sure.
I believe it's 6. So on days that they come in for treatment, they just do 1 set of each of the exercises. And on days where they don't come in for therapy, they do 2 sets.
Okay.
Yeah. So that's very important, because the idea is to try to carry over that loud voice into their daily life. Because, we tell them, it's important that we get you loud in our office, but we want you to walk through that door and be loud out in the community.
Right.
So
they get to keep that binder, and they can continue to do
Right.
the work and the homework. Is that recommended
It
to
is.
continually practice?
Yeah.
I mean, it's kind of like after a broken bone or a surgery or something that you don't just do therapy in the therapy office.
Right.
You need to kind of do it at home.
Right. Yeah.
To continue to make progress.
Yes.
And like we said before, because Parkinson's disease is progressive, it's going to keep getting worse. So the patient would have to keep up these exercises even after we discharge them to keep their voice loud.
Gotcha.
Because if they just say, okay, I'm done with therapy, my 4 weeks is done, I'm going to stop doing this, their voice is going to get soft
It's gonna
again
go back.
eventually.
Just
Yeah.
like doing
It will.
exercises for
Yeah.
an injury or something. If
Exactly.
Right.
It'll
Yeah.
go backwards. Do you know, and I'm sure this is a loaded and varied question, but does insurance cover this therapy? Like I guess Medicare, if it's mostly seniors or adults.
It does,
And I
yes.
know all insurances vary.
Right,
That's a huge
right.
disclaimer.
Yes,
Don't take
yes.
our word for it. Check with your insurance company.
Yeah, Medicare does pay for this.
Okay.
Thankfully.
I'm sure that's
Yes.
a big question for some people because that's
Sure.
a lot of sessions.
It is.
Yes.
It is.
A lot of it.
Yes.
Can somebody do it more than once? I mean, if they kind of revert back and maybe don't keep up on the homework, or if the disease progresses, you know, rapidly or whatever, can they come back for more?
Yes.
Yes,
That's for sure.
For sure.
Okay. Do you have that sometimes?
Not yet. Not
Okay.
yet. But I know
good.
for the big portion, I think that they schedule more maintenance
Okay.
sessions just to make sure that they're, you know, following through.
Keeping up on that.
Yes.
What other things about the treatment would you want to share, or so there's 16 sessions. Okay.
I do want to share, since I do work in home health most of my time, if someone is homebound and they have to have home health care,
great.
this can be done in home health as well.
Oh,
I always
okay.
ask first, hey, does your insurance cover it? Because if it doesn't, I won't do it. But usually the insurance, whatever they have, will cover it. And so if the patient wants to do that, we can definitely do it in the home as well.
Okay. Better to come. I mean, if you're able to get out, you can get out and
Sure.
come
Yes.
too. But if they're homebound, I didn't even think of that question. That's a
Yeah.
great thought. So you can do it in the home. I'm sure that's very helpful too, just to kind of almost be in your own environment and hear your voice in your kitchen,
Right.
actually
Yeah.
being loud.
And it's
Yeah.
actually better because they're using that loud voice at home already. So they're already seeing the difference in a way.
Gotcha.
Yeah.
Okay.
Yeah.
And I
Yeah.
do want to point out
Yeah.
again
Oh,
too,
absolutely.
since this is a voice treatment, we really recommend that any patient who wants to do this is seen by an ENT first, just because we need that clearance from an ENT to do this, because since we don't have x-ray vision, we can't see what's in your throat.
Right.
So we have to make sure that there's no structural damage or tissue damage going on, because if we go ahead and do treatment, we could do further damage to that.
Yes.
So we have to make sure that they see an ENT, an ear, nose, and throat doctor, that they clear them and that we can see
Okay.
them for treatment, yes.
So do they do, when they do clearance, do they do x-rays or swallows or any?
What they usually do is they'll take a very small tube with a camera at the end, and they'll go through the nose down to the throat
Okay.
and just kind of see.
Okay.
They get a real live look at that tissue, and they're professionals at this. They
Sure.
know exactly what they're looking
Right.
for.
What's normal, what's not normal.
Exactly,
Right.
yes.
Okay, didn't think of that either. Thank you. Yeah, that you would want to make sure to rule out any other things before you proceed with your therapy.
Right.
Yes.
Awesome. This is
Yeah.
exciting stuff, I bet,
It
for people
is.
with Parkinson's disease.
Oh yes, they
It
get very
is.
excited
I
once
bet.
they
Yeah.
start. Yeah, seeing the
Awesome.
difference.
Okay. So a little bit an order from a physician, clearance from an ENT, scheduling the sessions can be done at home.
Yes.
Awesome.
Yeah.
Thank you, ladies.
Yeah.
Thank you.
All
Yeah.
right, we're going to take another break and we'll be right back. And we're back. I want to thank Brianna and Ashton for being our guests today, talking about this pretty darn cool therapy for people who have Parkinson's. Because Parkinson's is not particularly cool sometimes. It can be very, very difficult for people. So this is a great therapy. It's been around for a while. So wherever you are watching this video, check with your healthcare provider, see if it might be appropriate for you. The number for therapy at Magruder, we're going to put up on the screen because I'm not totally sure I have it memorized right. So I'm going to have them put it on the screen for you. Use this information, maybe share it with somebody you know and love. It might be helpful for them. And until we meet again, as always, I encourage you to make time for health.